proven to say that there is no economic impact as far as a negative impact. If a business goes smoke-free, whether it be a bar, restaurant, or whatever it may be, that they actually found it has been actually the opposite, where the revenues have actually went up for people who decided, well, I'm not going to go to that place because it's always filled with smoke. You know, every time I leave out of there, I'm smelling like smoke. Well, now if you remove that, now people are more kind of willing to be able to go to that establishment. So they actually found, like I said, the opposite, where it really hasn't affected the dollar. I mean, there is a transition period for it, you know, for any time that you're changing kind of like policy or anything like that. So you'll go through that period there. But when you look at the as a whole and you look at your revenues, then we're definitely seeing the opposite. The businesses are actually making more money. You know, for every one smoker that decides that they're not going to go to that restaurant, you got 5 non-smokers who are walking in. So I mean, people are it's become like more of a greater economic impact for communities when they go smoke-free.
Right. So within your educational classes, so you have these educational classes for people with substance problems, and alcohol is one of them. In the context of this, is there any historical context of alcohol accessibility and use against people in that kind of education? I often wonder, would that help? Just
like, for example?
For example, alcohol historically has been used to oppress, to dominate, to destroy peoples. I mean, it was a major part of how the United States of America was established. Okay, so the Pilgrims came, but with that whole was the alcohol. The introduction of alcohol to the native peoples, get them drunk, wipe them out. Next thing you know, we wake up and somebody else is owning our land. Fast forward to today, again, where I was saying how you see this proliferation of liquor stores in certain neighborhoods, not others. And then the contrast of what is sold, like say in a store in one area of town, and then fine wines and etc. in other parts of town. So yes, so anyway, that's kind of what I'm talking about. So is there any attempt to help people to understand that even today, that whole proliferation of accessibility of these drugs, and alcohol and tobacco are drugs. Did y'all ever ask, did I ask the question? But they are drugs, but that easy access for certain segments of society, because then you see I'm drunk and I ain't gonna vote today. I'm drunk and I'm more likely to beat my wife and children. I'm drunk. So anyway, so a question, is it part of the education as you are trying to deter, talk to people about why not to use? Is that because that's part, again, when we start talking about social health, and it's so relational, you know, there is this whole thing that I'm doing to myself, to my body, but it also impacts my community, my family, which I am a vital part of. I am an important part of. And so if I am abusing to the point where I just don't see all of these other things, so.
Okay. Well, some of the information we try to convey, I think, to the person is that it is a health issue.
Yes.
And it's not only an issue that affects their health, but it affects the health of their family in the sense of those relationships.
Yes.
I don't know that we've probably done much good work in the area of trying to help people understand that there are many times that their vulnerabilities are taken advantage of. So we haven't talked about the concentration of liquor stores in certain areas so much as we have talked about the risk associated with the kind of use patterns that they have. You know, when a liquor store chooses to sell alcohol to someone who's already intoxicated, they're breaking the law. When an alcohol serving establishment continues to serve someone who they know is intoxicated, they're breaking the law.
Absolutely.
So holding them accountable is one piece. But the other economic part that you talk about is when you've got a very valued customer who's spending a lot of money.
Right.
Do you cut them off? Well, ethically, legally, you should. Do you? We know that there's a lot of very responsible alcohol serving establishments
Yes.
that make sure that their customers who may have had one too many get home safely. We know
Yes.
that there's a lot of establishments like that. We also know that there's some others that operate differently. You know, selling single cans makes it very accessible versus, you know, having to buy a greater quantity. You know, I see people sometimes early morning hours and, you know, very tall cans of beer walking out of a liquor store. And I
Right.
think, you know, this is somebody who, you know, should they be drinking at this hour? You know, I'm not judging at that point,
Right,
but it's
right.
really a matter of saying, you know, if this is going to be a health issue, is it healthy for them?
Is it healthy?
And what are the risks associated with their use? And we know, especially with alcohol and other substances, it becomes a family issue, a family disease. And so if the person decides to get help, their family needs help too, because they've all been really affected by that. And I think it is different, like with cigarettes you're talking about, because when we talk about low risk use, we're still talking about consumption, whereas with you, it's really an abstinence space. We look at abstinence really with 4 different groups. One is we discourage underage drinking.
Right.
We discourage women who are pregnant from drinking while pregnant.
Yes.
We discourage folks who are going to be driving a vehicle to drink any amount of alcohol prior. And then those who have alcoholism, we really encourage that they learn how to abstain.
Yes.
Other than that, we do talk more about low risk use. What's going to affect your health? And if you ask somebody, would you drink, you know, 8 cans of pop in a day or 8 cans of green beans? Would you eat that? You know, they kind of think, well, that's way too much of one thing.
Right.
But it's not unusual to hear someone have 6 or 8 cans of beer. And so trying to just get them to recognize that this is a mood altering substance, it's affecting their brain, it's affecting all parts of their body. Is it healthy for them? And many times when it's approached as a health issue, it becomes much less threatening. People aren't quite as defensive about it because you're really not
Exactly.
attacking them.
Exactly.
You're talking about the well-being of their health.
And I was going to say on the tobacco side that is one of the things that we do in our presentations, that we do talk about how the tobacco industry does target, whether it be minorities or how they target the youth. One of the things that we always look at as far as like the number of places that are selling tobacco products and what is the close proximity. Are they to middle schools, elementary schools, and high schools? Are they in lower socioeconomic neighborhoods and whatnot? So even like as we call point of sale marketing, where you see all the posters and the billboards. I always say, you know, you never know, does that place even sell water or chips? You know, but you know they sell tobacco.
Exactly.
You know
And what
that.
brand.
You know, before you even get to the parking lot. So it's kind of like letting people understand and be able to see that. So that's one of the things that we try to do, and we'll definitely be ramping that up even more, just so people can start seeing those things like, wait a minute, yeah, I never really noticed it. Or like where they may place the posters, you know, like I said, either on the outside, or a lot of times when you go inside of the places, they actually have them at the eye level where children are. So it's like, why do you have that cigarette poster way down there instead of up here, you know, or why do you have, you know, the dissolvable tobacco next to the Tic Tacs, you know, why do you have that, you know? So kind of like letting people understand and be able to see this is how they actually are marketing you. This is how they're targeting you as far as when it comes to tobacco usage.
Right. And Sharon brought up something. They just had tried to pass the legislation to allow grocery stores and things to sell on Sundays. And then there was this big pushback. But then I was thinking, maybe another advocacy issue that maybe a community could unite around is the opening of liquor stores only from 12 noon to 6 p.m. or something. Just limiting the amount of time that they could, but then, you know, there's always the bars. but-
Restaurants, yes. Like,
It goes on and
But
on.
you know what? It was even the whole trying to encourage more activity downtown was the granting of all those liquor license, those easy liquor license.
Inexpensive, too.
Inexpensive. They got rid of a lot of the red tape around.
The one thing that Indiana doesn't have anymore is a happy hour. In terms of drink specials.
Right.
They can run drink specials, but they have to be throughout their entire business day. So
Okay.
if they want to sell beer at a reduced price on a Tuesday, that's okay as long as they do it from when they open to when they close. When they used to do it on a short amount of time, very concentrated, like 5 to 7, people would go in and drink as much as possible during that short amount of time. So it, to some degree, that really encouraged that. So they have changed that. In terms of also making things special, like no cover for certain people, and they can do food disc. I mean, they've tried to do some things that way. It really, so much of it comes down to personal responsibility, though, too. Really helping a person recognize that the risks that they're taking, and what I often see is the folks after they've taken that risk and the consequences that they're facing, and that's not the time to really learn. I mean, it's helpful if you can do it beforehand, but I think most times folks don't think it's going to cause them that kind of problem. They don't think they're going to get arrested. They don't think that their relationships are going to end because of their use. When they do, that's many times when they start to recognize that perhaps what they're doing, the pattern of their use, is becoming problematic and things need to change.
Right. And, another question I have is the profiteering of, say, health organizations in alcohol. I went to a health summit one time. So we, you know how you go to health summits, you go into workshops and you have brainstorming, and different communities rank their health issues. And so for most of us, substance abuse came out as number one. And so, okay, fine. And so we're going to come back and we're going to put all of this together into a final report. So it's lunchtime. And so the doors to the ballroom break open, and right there is this big, humongous alcohol pyramid.
Wow.
Okay.
Interesting. Both sides of the mouth. That's what,
So how do we, in this era of social acceptability, even questioning, what do we do? Because, again, a lot of times there's all this focus on young people. And this talk about peer pressure. I don't know about you, but when I was younger, my friends honored and respected the fact that I didn't drink, because I was the one who could, like you said, look out, for the girlfriend who might be pulled off to the room because she was a little inebriated, or could always be that we'd always have a designated driver. But as I got older, when I was an adult, and you'd go to events with your coworkers, and they'd always talk about, they'd be having drinks. So we'd go to these things and we'd have drinks. And they'd always, well, why aren't you drinking? I don't like alcohol. I don't drink alcohol. Well, come on, just one. Just try it. And after a while, it got to the point where I'm like, I'm having more fun sitting here watching you go from straight sober to drunk. Watching as your mouth twists, your words become slurred. That's my joy. So the pressure is more, I've always felt, from adults, But and I question this whole notion of social acceptability, because any amount of alcohol, you are off. You're no longer your natural, normal self.
sure, one drink can impair
So
that.
why is it we are challenged to have social environs without alcohol? Why is it that I need to be off to be in the company of my peers? Is it that I need, in case I have a social faux pas, I have something to blame it on?
Blame it on alcohol.
That's true, though.
So I just raised all of these things. And again, when we look at the discussions about, say, marijuana or the legalization of other drugs, tobacco, alcohol are drugs. They are drugs as well. So what is the difference? Why are these so socially acceptable? Again, when we look at how the profiteering, when we look at the wealth of some of the families, the folks, this is where it came from, tobacco. And you see now one of the Reynolds sons or grandsons, great-grandsons, is now on this whole anti-tobacco campaign because he watched his family members all die. You know, we see the Kennedys, you know, how, and talk about politics, you know, you have prohibition. You shut down, you pay these politicians to, and then you quietly go around and buy up all the useless liquor licenses. And then you turn around and your politicians' friends, now liquor is again legal. So one cat's sitting here holding all the liquor licenses. Yes. And all of that is relative to our lives today. Those kinds of things affect our ability to say no or say yes to what's going on in our community. Those kinds of things disaffect your efforts to create safe, healthy work environments for folks when you got all of these, now you got all these substitutes for tobacco.
Yes.
You know,
That's our next
The electronic
challenge.
cigarettes.
electronic
Yes.
cigarettes. But
Vaping.
even the smokeless tobacco, you know, they
Sure.
put things in different forms. You have people who come to work with all of these green drinks and clear liquids that are what?
Not water. We know that. We know that. You know, I don't know what we can do at this point. I think alcohol has become very acceptable in terms of use. I think the biggest argument would be that for the majority of the population, if used at a low risk, doesn't cause problems.
It doesn't.
But for those that it does, the problems are just amazing. I mean, how much it affects their health, how much it
Yes.
affects their family, their personal safety.